name is Lacey Scafidel, and this is my persuasive speech, and this is my audience. More than 40 million Americans are receiving welfare, such as food stamps, and another 10 million are receiving unemployment. In the past several years, since welfare reform, the issue of substance abuse among welfare recipients has arisen periodically as a policy and pragmatic concern. In recent years, policy debate has focused on welfare policy and proposals to require drug testing as a condition of eligibility. States typically address substance abuse in their welfare programs at state levels. I believe Americans who can afford to buy drugs can afford to buy the necessities to live without the help of the government who supply them with welfare. Applicants who are receiving government assistance should be drug tested to help save the government money and stop funding the drug addicts in the society. Studies of substance abuse among welfare recipients have varied widely in finding with rates of between 4 and 37%. Not stating that all recipients are drug addicts, but those that are should not be assisted by the government. Employers require drug testing before employment, so why shouldn't welfare recipients get the same treatment for the gift of receiving government fundings? It is the taxpayers of working people funding someone else's addiction. Drugs use and its consequences affect all of society. Drug use strains our health care, criminal justice system, and endangers the future of our young people with an overall strain on our economy. According to New York Times, this year, at least 29 states considered drug testing for people who receive cash assistance from the primary federal welfare program, temporary assistance for needy families, but only 2 measures passed, according to the National Conference of State Legislature. 10 states considered testing laws for unemployment, compensation benefits, and 2 measures passed. Advocates for the poor say that testing policies single out and vilify victims of the recession, disputing the idea that people on public assistance are more likely to use drugs. They also warned that to the extent that testing programs were successful in blocking some people from receiving benefits, the inability to get money for basic needs would aggravate the drug addicts and increase demand for treatment. Discreet News said that Utah is one of at least 8 states that have passed legislation requiring drug testing or screening for public assistance applicants. Similar laws were passed in at least 29 states this year, according to the National Conference of State Legislatures. Utah's law also doesn't disqualify people who test positive from receiving benefits. Instead, it requires them to enter substance abuse treatments. The Huffington Post said that Utah caught 12 applicants using drugs. This is a graph that shows the states that have voted to have the policy in their in their state. Some people may argue that drug testing will be a cost burden. The magazine Governing says that Florida chapter of the American Civil Liberties Union recently showed that drug testing actually costs the state money. The $30 spent per test ended up costing a total of $45,000 more than the state saved in welfare payments. Though Columbus Dispatch said critics say drug testing unfairly stigmatizes poor people and wastes tax dollars, as incident rates in other states have been relatively low. The Associated Press recently reported that Utah spent $25,000 on screening applicants. In Florida, 108 tested positive than the 4,000 who submitted to drug testing. Schaefer from Associated Press article said the number of welfare applicants using drugs is likely higher because many do not return to be tested. Under Schaefer's proposal, applicants for Ohio's welfare program who say that they have used drugs in the past 6 months would have to undergo a drug test. If the test is positive for drug use, the applicant who would be banned from receiving welfare benefits for at least 6 months and referred to drug treatment. The bill set aside $100,000 to residential treatment for the most serious abusers. Schaefer said most applicants would qualify for Medicaid, which covers community-based services. Though I believe people who are applying for government assistance should pay for their drug screening, and if they test negative for the drugs should be refunded their money and be allowed to receive government assistance, though people who test negative are out of the money that the test cost. With the result of drug testing, this may prevent people from applying for welfare and may force them to find a job, helping the government save money. By saving the government, more programs can be built for people who are in need to help from welfare. People accuse the government of abusing their Fourth Amendment when drug testing the applicants. However, people who apply for jobs also are drug tested before getting hired, and people do not complain about that. People have become very lazy and dependent upon the government. Even though it may seem that jobs are scarce, people should not rely on the help of the government to help them get through difficult times. The government should be for people who are worthy of the assistance, not people who are addicted to drugs. Thank you. Are there any questions?
Which 8 states require the drug testing?
Arizona, Florida, Georgia, Kansas, Missouri, Oklahoma, Tennessee, and Utah.
And which of your resources was the most helpful?
New York Times. Thank you.